Another entity, which is a kind of a complicated pyelonephritis, is Xanthogranulomatous pyelonephritis, and most of the time there are granulomatous inflammations. There are kind of a mini granuloma formation, just like in TB. If you could appreciate here, this is the right kidney and left kidney. So you can see these large granulomatous lesions in the kidney, and the edematous, and there's extensive scarring, and obviously you need to treat these Xanthogranulomatous pyelonephritis again with the broad spectrum antibiotics, and they're also necrotizing, and maybe possible you're giving a broad spectrum antibiotic and the patient do not respond to these, then obviously it will end up in the nephrectomy. As you can see here, this is the cross-section and after the nephrectomy, and you can see the large granulomatous lesions which are present in the renal pyramid. So this is the cross-section which is showing this xanthogranulomatous lesions and large granuloma formation with extensive scarring and a fibrosis of the kidney, and there is no other option left other than nephrectomy.